Hello and welcome to our webinar on flu vaccine and administration. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects related to the flu vaccine and its administration for the 2025-2026 flu season. So a few housekeeping items to go over with you before we start the webinar. You can find the link to the encore presentation of this webinar on our website's Training Center page at www.wpsgha.com, and it will be accessible for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist, and both should be available within the next 15 business days. If you have any questions, please put those questions into the chat. We will answer questions as time permits. Should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterward. We really want your feedback. It helps us develop the education on topics that may be of interest to you. Consider taking our survey to let CMS know what you did like and what topics you'd like to learn more about. So Mary Sue, it looks like she has already placed a link to the survey into the chat. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while viewing the encore presentation. To access the survey, click on the circle with the eye in the upper right corner of the video. A link to the survey can also be found in the description of the video. On this next slide, we have our disclaimer. Medicare rules change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. These do take precedence over anything presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on the Training Center page of our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. On this next slide, you'll notice several acronyms that will be used throughout this presentation. While you might be familiar with some of them, or even all of them, feel free to refer to this slide if you come across an acronym you don't recognize. So let's get started. In the United States, flu season typically spans from October through May, with peak activity most commonly occurring between December and February. With flu season just around the corner, now is an excellent time to begin discussing flu vaccination scheduling with your Medicare patients. The CDC recommends that everyone aged 6 months and older receive a flu vaccine annually, ideally in September or October. However, some individuals, such as pregnant women and young children, may be vaccinated earlier based on clinical guidance. The flu vaccine and its administration are covered under Medicare Part B as part of the Preventive Services benefit. Our objective for today is to provide an overview of the clinical aspects for the Medicare Preventive Service of flu vaccine and its administration. During today's webinar, we will cover background information about the flu, different types of flu vaccines available for the 2025-2026 flu season, and Medicare Part B coverage criteria for flu vaccine and its administration. Let's begin with some facts about influenza, also known as the flu or the flu vaccine. And throughout this webinar, we will use the terms influenza and flu interchangeably. According to a CMS September 2024 report on annual influenza vaccinations for Medicare beneficiaries, an estimated 70 to 85% of seasonal flu-related fatalities in recent years have occurred among individuals aged 65 and older. Additionally, approximately 50 to 70% of flu-related hospitalizations affect the same age group. The Centers for Disease Control and Prevention reported that the 2024-2025 flu season was classified as high severity across all age groups, including children, adults, and older adults. This marks the first such designation since the 2017-2018 season. However, receiving an influenza vaccination can help prevent beneficiaries from getting sick with the flu. The CDC notes that the flu shot typically reduces the risk of flu-related doctor visits by 40 to 60%, when well matched with circulating strains. And even if it doesn't fully prevent infection, it often lessens illness severity, hospitalization risk, and complications. So, what is the flu? The flu is a contagious respiratory illness caused by the influenza viruses. These viruses target the nose, throat, and occasionally the lungs. The severity of illness can vary from mild to severe, and in some cases, it can be life-threatening. The flu is primarily spread through tiny droplets released in the air when an infected person coughs, sneezes, or talks. The virus can be transmitted to others even before symptoms appear, as well as when the person is visibly sick. Individuals with the flu are typically most contagious during the first 3 days of their illness. The incubation period, or the time between exposure to virus and onset of symptoms, is usually about 2 days, but it can vary from 1 to 4 days. Symptoms of the flu tend to come on suddenly and may include fever, though not all patients will present with one, along with sweating and chills, headache, cough, runny nose and stuffy nose, sore throat, muscle aches or body aches, fatigue, and in some cases, vomiting and diarrhea. Most individuals who contract the flu will typically recover within 2 weeks or less. However, in some cases, complications can arise as a result of the infection. These complications are generally characterized as either moderate or severe. Moderate complications may include sinus infections and ear infections. Severe complications resulting from the flu can include pneumonia, myocarditis, encephalitis, meningitis, rhabdomyolysis, multiple organ failure, and sepsis. Severe complications can be dangerous and in some cases life-threatening. While anyone can get the flu, some individuals are at a greater risk of experiencing severe illness or complications. These higher risk groups include people 65 and older. As people age, their immune system becomes less effective, making it more difficult to fight off infections like the flu. Older adults are also more likely to have underlying health conditions such as heart disease, diabetes, or lung disease, which can further increase the risk of flu-related complications. This group accounts for the majority of flu-related hospitalizations and deaths annually. Next is young children, particularly those under 5 years of age. Children under age 5, particularly those younger than 2, are more likely to experience severe flu symptoms and complications such as pneumonia, dehydration, or worsening of chronic medical conditions. Young children with underlying health issues like asthma, congenital heart disease, and neurological disorders face an even higher risk. The third group is infants under 6 months of age. Babies younger than 6 months are too young to receive the flu vaccine. Because their immune systems are still developing, they're especially vulnerable to severe disease. Protection from this group relies heavily on those around them being vaccinated, including mothers during pregnancy, who can pass antibodies on to their infants. Next is individuals with chronic medical conditions such as asthma, heart disease, stroke, diabetes, HIV, cancer, and chronic kidney disease. Chronic illnesses can impair the body's ability to fight infections and increase the risk of complications from the flu. Our next group is people with weakened immune systems. Immunosuppression can result from medical treatments such as chemotherapy, radiation therapy, organ or bone marrow transplants, or long-term use of corticosteroids or other immunosuppressive drugs. These individuals have reduced defenses against the flu and may not respond as effectively to vaccination, making preventive strategies and early treatment crucial. Our next group is individuals with severe obesity. Severe obesity is defined as having a body mass index of 40 kilograms per meter squared or higher. These individuals are at a greater risk of flu complications. Obesity can impair the immune system and immune function and impair lung capacity, making it harder for the body to cope with respiratory infections like influenza. Our next group is residents in communal living facilities, such as assisted living facilities and long-term care facilities. These environments can facilitate rapid spread of respiratory viruses, including influenza, among especially among those with underlying health vulnerabilities. And our last group is those who are pregnant. Pregnancy causes changes in the immune system, heart, and lungs that can increase the risk of severe flu illness. Flu complications can affect both the pregnant woman and her fetus, potentially leading to preterm labor or delivery. Flu vaccination during pregnancy also helps newborns during the first few months of life when they're too young to get vaccinated. When identifying individuals at higher risk of flu complications, it is important to consider that vaccination rates tend to be lower among Black, Hispanic, American Indian, and Alaska Native populations. Factors that may influence lower vaccination rates include limited access to health care and insurance coverage, as well as concerns about vaccination safety. The flu can be diagnosed by obtaining a sample of bodily fluids. This can be done either in a healthcare facility or at home. In a medical setting, the healthcare provider typically collects the sample using one of two methods. The first method involves swabbing the inside of the nose or throat with a specialized swab. The second method is nasal aspiration, where a saline solution is gently introduced into the nose, then suctioned out to gather the sample. For at-home testing, there are also two common approaches. One option is for the patient to use a rapid antigen test, which requires swabbing the inside of the nose. This collection method provides results within 30 minutes or less. Alternatively, the patient can collect the sample themselves, either using a nasal swab or saliva, which is then sent to a laboratory for analysis. Flu results indicate whether influenza A or B virus particles are present in the sample. A positive test suggests the patient is likely infected with seasonal flu. The flu is treated with prescription antiviral medications. It is important to seek treatment at the first sign of the flu because antiviral treatment is most effective when started within the first 2 days of symptom onset. However, starting treatment after this period can still offer benefits, including a reduced risk of flu-related complications. Antiviral treatment can help lessen the severity of flu symptoms and shorten the duration of the illness. It can also help lower the risk of serious complications such as pneumonia, hospitalization, or worsening of chronic conditions. The FDA has approved 4 CDC-recommended antiviral medications to use for treatment of the flu. The first medication is oseltamivir phosphate. This medication is for individuals 14 days old and older. It is given orally as either a pill or a liquid suspension. Tamiflu is the most commonly prescribed antiviral treatment for flu and is considered the preferred option for young children and pregnant women. The next medication is zanamivir. This medication is for individuals 7 years old and older. It is given through inhalation of powdered medication. Zanamivir is not recommended for those with breathing issues. The third medication is peramivir. This medication is for individuals 6 months old and older. It is given intravenously, usually in a hospital or an outpatient infusion setting. The last medication is baloxavir maboxyl. This medication is for children ages 5 to 11 with no chronic medical conditions and all individuals ages 12 and older, regardless of health status. It can be given orally as either a pill or a liquid suspension. For the best results, this medication should be taken within 48 hours of the onset of flu symptoms. Baloxavir marboxyl is not recommended for women who are pregnant or lactating, as the FDA pregnancy category for this medication has not been assigned. In addition to starting treatment, several supportive measures should be taken when someone is diagnosed with the flu. These include staying home and limiting contact with others until at least 24 hours after the symptoms have improved and the individual has been fever-free without the use of fever-reducing medications for at least 24 hours. Getting plenty of rest to support the body's recovery, maintaining a balanced diet and staying well hydrated by drinking plenty of fluids, managing symptoms with over-the-counter remedies such as acetaminophen or ibuprofen for fever or body aches, and using cough drops or throat sprays as needed for sore throat and cough. regularly cleaning frequently touched surfaces to help prevent the spread of the virus, covering coughs and sneezes with a tissue, then promptly throwing the tissue away in the trash, washing hands often with soap and water, and if soap and water are not available, an alcohol-based hand sanitizer can be used to perform hand hygiene, and improving air quality by opening windows for fresh air, using an air purifier, or spending time outside when possible. One of the most effective ways to protect against the flu is by getting a flu shot every year. The flu vaccine works by stimulating the production of antibodies in the body. This typically occurs around 2 weeks following vaccination. The antibodies protect against the flu viruses that experts believe will be most common during the upcoming season. Getting vaccinated offers many benefits, including reducing the risk of getting the flu, reducing the chances of being hospitalized, and help preventing deaths related to flu complications. So let's take a closer look at how the flu vaccines are made. The flu vaccine is made using several different methods of preparation. Egg-based vaccines are the most common. They are made by growing the flu virus in chicken eggs. After a few days, the fluid containing the virus is taken from the eggs, and the virus is killed and purified to create the vaccine. Since the vaccine only contains a small amount of egg protein, it is still considered safe for those who have severe egg allergies. However, since there are other methods of preparation for the flu vaccine, those with severe allergies to eggs are sometimes given the flu vaccine made by a different preparation method. The decision to use an egg-based vaccine in those with severe allergies should be determined by the person's healthcare provider. Cell culture-based vaccines are made from inactivated viruses grown from animal cells. Some studies have shown that this type of vaccine may provide stronger protection against the flu when compared to egg-based vaccines. Recombinant vaccines are made synthetically. They do not require chicken eggs or the flu virus. For the 2025-2026 flu season, all vaccines in the United States are trivalent. Trivalent vaccines provide protection against 3 different types of influenza viruses. The trivalent vaccines available in the United States for the 2025-2026 season contain vaccine viruses or viral proteins from 2 influenza A subtypes, H1N1 and H3N2, and 1 influenza B virus from the Victoria lineage. These vaccine components are chosen based on worldwide surveillance and are designed to protect against the flu strains most likely to circulate during the upcoming season. For more details on how the FDA's Vaccine and Related Biological Products Advisory Committee determined the composition of the 2025-2026 flu vaccines, refer to the document entitled Influenza Vaccine Composition for the 2025-2026 U.S. influenza season, and a link to this has been included on the resources slide at the end of the presentation. There are 9 flu vaccines available for the 2025-2026 flu season. We will start with the vaccines that are administered intramuscularly. These vaccines can be given in the anterior lateral thigh for infants and children up to age 2, and in the deltoid muscle of the upper arm for individuals age 3 and older. The 5 egg-based inactivated IM influenza vaccines include Fluarix, Flulaval, Afluria, Fluzone, and Fluzone High Dose. Fluarix, Flulaval, Afluria, and Fluzone are approved for individuals 6 months old and older. Fluzone High Dose is approved for use in adults age 65 and older. It may also be given to individuals age 18 to 64 who have received a solid organ transplant and are on immunosuppressive medication. Flublok is a recombinant hemagglutinin IM influenza vaccine. It is approved for individuals 18 years old and older. Flucelvax is a cell culture-based IM influenza vaccine. It is approved for individuals 6 months old and older. Finally, Fluad is an adjuvanted IM inactivated influenza vaccine, and it is approved for people age 65 and older. And for individuals age 65 and older, the preferred flu vaccines are Fluzone High Dose, Flublok recombinant influenza vaccine, and Fluad adjuvanted influenza vaccine. This recommendation is based on a review of several studies indicating that these vaccines may be more effective in this age group as compared to standard non-dose, non-adjuvanted flu vaccines. For people under 65 years old, there's no specific vaccine preference. Side effects from the intramuscular flu vaccines include soreness, redness and/or swelling at the site of injection, mild headache, muscle aches, fever, nausea, fatigue, and fainting post-injection. As with all vaccines, rare but serious allergic reactions such as anaphylaxis may occur. Symptoms can include hives, facial or throat swelling, respiratory distress, tachycardia, dizziness, or generalized weakness. Immediate emergency treatment, including administration of epinephrine, should be provided. Healthcare providers must report such incidents and events to the Vaccine Adverse Event Reporting System as required by federal law. The last flu vaccine available is FluMist. It is administered as a nasal spray. FluMist has only been approved for use in healthy, non-pregnant people ages through 49. This vaccine should not be used in pregnant women, individuals with a history of severe allergies to any ingredient of the vaccine, those with a history of allergic reactions to a previous dose of any flu vaccine, or people with certain medical conditions, including those who are immunocompromised, children ages 2 to 4 with asthma or a history of wheezing in the past 12 months, children and adolescents ages 2 through 17 who are receiving aspirin or salicylic containing therapy, and people who care for or live with severely immunocompromised individuals. In adults, side effects from nasal spray include headache, runny nose, sore throat, and cough. Medicare typically covers a range of influenza vaccines, including both standard dose and high dose formulations. However, it's important to check Medicare guidelines for the most current information, as covered vaccines may vary from year to year. Now that we've reviewed the various types of flu vaccines available, let's discuss how Medicare covers the flu vaccine and its administration. Medicare Part B covers flu vaccinations for all individuals enrolled in Medicare Part B. Typically, Medicare Part B pays for one seasonal flu shot per flu season. However, if a healthcare provider determines that additional flu shots are medically necessary, Medicare may cover those as well. If a person chooses to receive flu shots twice within the same calendar year, but covering 2 different flu seasons, both vaccinations are eligible for Medicare coverage. There is no copayment, coinsurance, or deductible as long as the healthcare provider accepts assignment. For most people, the best time to get a flu vaccine is during September or October. However, some groups may be advised to get vaccinated earlier. Pregnant women in their 3rd trimester can receive a flu shot in July or August to help protect their infants from the flu once they are born, as newborns cannot be immunized at that age. Children requiring 2 doses of influenza vaccine should receive their initial dose as soon as the vaccine is available, with the second dose given at least 4 weeks later. Additionally, children who have healthcare visits scheduled for July or August and who may not have another chance to get vaccinated may also be recommended to receive their flu shots earlier. Remember, because the exact timing and duration of the flu season can vary year to year, Medicare generally covers one influenza vaccination per season when it is considered medically reasonable and necessary. However, in some cases, if the healthcare provider determines it's medically necessary, Medicare will also cover a second flu shot in the same season. Documentation requirements for flu vaccine and administration include date service was provided and details regarding the administration of the vaccine, including date it was administered, the manufacturer and lot number, site the vaccination was administered, dosage, route, and name and credentials of the person administering the vaccination. There also should be documentation of submission of appropriate billing codes to Medicare. Remember to confirm all documentation is dated and signed with the provider's credentials. According to Medicare Benefit Policy Manual, Chapter 15, Section 50.4.4.2c, and Medicare Claims Processing Manual, Chapter 18, Section 10.1.2, Medicare does not require a physician's order for coverage of the influenza vaccination. The influenza vaccination can also be administered without physician supervision. Before administering the flu vaccine, ensure the patient has met the eligibility and frequency criteria for this preventive service. The Centers for Medicare and Medicaid Services will reimburse 100% of reasonable cost for flu vaccines and their administration in rural health clinics and federally qualified health centers. This payment is separate from the standard FQHC prospective payment system or the RHC all-inclusive rate. This change aims to simplify the payment process for all Part B vaccines in these settings. Additionally, beginning July 1st, 2025, RHCs and FQHCs will be able to bill all 4 types of Part B preventive vaccines, including the flu vaccine and its administration, at the time of service, regardless of whether a qualifying visit occurs. Medicare offers additional reimbursement for administering Part B preventive vaccines, such as the flu vaccine, when given in certain patients' homes. This applies to individuals who are unable to leave their homes due to a medical condition that prevents them from leaving home without assistance, such as use of a mobility aid or requiring help from a paid or unpaid caregiver, being at higher risk for contracting a disease if they leave home, requiring considerable and taxing effort to leave the home, having a disability, or having a clinical, socioeconomic, or geographic barrier to receiving the vaccination outside their homes. Locations that qualify as a Medicare beneficiary's home include a private residence, temporary lodging, for example, a hotel or motel, campground, hostel, or homeless shelter, an apartment in an apartment complex, or unit in an assisted living facility, group home, or non-Medicaid nursing facility, communal spaces in a multi-unit or communal living arrangement, and assisted living facilities participating in the CDC Pharmacy Partnership for Long-Term Care Program, where resident vaccinations are provided through this program. The following locations do not qualify as a home for additional payment amount: hospitals and Medicare skilled nursing facilities and Medicaid nursing facilities, regardless of whether they are the patient's permanent residence. Healthcare providers should clearly document the patient's specific reasons or barriers that prevent them from receiving vaccinations outside the home. However, patients do not need to be formally certified as homebound to qualify for in-home vaccination administration. Medicare provides the additional in-home payment only when the sole purpose of the visit is to administer one or more Part B preventive vaccines. If another Medicare coverage service is delivered in the same home on the same day, the additional in-home payment will not be made. In such cases, only the standard vaccine administration fee applies. For the calendar year 2025, Medicare pays approximately $74 in in-home administration for Part B vaccines such as the flu vaccine. This total includes the standard administration fee of about $34 and an additional in-home payment of approximately $40. These payments are geographically adjusted based on the location of the service and are updated annually to reflect changes in vaccination administration costs. When the flu vaccines are administered to more than one Medicare patient in the same home or communal living setting on the same day, Medicare pays the standard administration fee for each vaccine. However, the additional in-home payment is made only once per patient per date of service, regardless of the number of Part B vaccines administered. Additionally, Medicare will pay the additional in-home fee for up to 5 vaccine administrations per group living location per day, but only if fewer than 10 Medicare beneficiaries receive a vaccine there on the same day. If 10 or more beneficiaries are vaccinated at the same group living location on the same day, the additional in-home payment is limited to one per home or communal space. For further details, please refer to CMS's In-Home Vaccine Administration Additional Payment. A link to this can be found on the resources slide at the end of the presentation. Flu vaccines remain one of the most effective ways to prevent severe flu infections. The flu can lead to complications, hospitalizations, and in some cases even death. Having a conversation with your patients about getting their seasonal flu vaccine is key to helping them stay protected during this flu season. So as a recap, during today's webinar, we provided background information about the flu, reviewed different types of flu vaccines available for the 2025-2026 flu season, and discussed the Medicare coverage criteria for flu vaccine and its administration. On this slide, I've included links to resources related to the information we discussed today. These resources include materials from the Centers for Medicare and Medicaid Services website, such as MLN 006559 Medicare Preventive Services Chart and the vaccine pricing webpage, as well as details on additional payments for in-home vaccine administration. Next is a link to the FDA's influenza composition for the 2025-2026 U.S. influenza season. There is also a link to influenza information from the Centers for Disease Control and Prevention website. The final links directly to two resources: the billing presentation titled Encore Preventive Services, Influenza, Pneumococcal, and COVID Vaccines and Administration, and the Encore Presentations playlist on our YouTube channel, where you can access recordings of past webinar events. We encourage you to view these presentations for further education on a variety of topics. Please use this slide as a reference when reviewing the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. And if we don't get to your questions today during the presentation, we will send out a document to all participants with the answers following this webinar. And I am just looking through the chat, and I do not see any questions. However, if you do think of one while we're doing the follow-up slides, just put it in the chat and we can go back and address it. For those attending today's live event, in a few minutes, you will receive an email thanking you for attending. The email should look like what you see on this left-hand side of your screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as a link to take the survey. If you haven't completed it already, please take a few moments to complete the customer satisfaction survey. The contact hours for this event can be found in this email, should you require them for earning credit to continuing education units. If you don't see it, please check your junk or spam folder. Make sure to add the WebEx email address messenger@webex.com to your safe sender, safe receiver list to avoid these emails going to junk or spam. And if you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. And we have been told that some people, when they use their cell phones to log in, have also had that issue. So if you just send an email to that our educational mailbox with the phone number you used, we can send you your certificate of achievement. Following today's live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put flu vaccine administration in the subject line. However, if you have claim-specific questions, please do not send those to provider outreach and education. Please direct those questions to our customer service department, as we do not have access to your claim information and therefore are unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us about your experience, including what you liked, what we could do to improve, and suggestions for future education. Your feedback really is invaluable for helping us deliver the education that you need. We use your feedback to develop topics for future educational events. There are several options you can use to take the survey depending on your preference. For those attending today's live event, the first option is to click the survey link in the chat. The other option is to take the survey on the CMS Qualtrics page. So when you exit this webinar, you'll be asked to go to an external site, and that external site is the CMS Qualtrics page for the survey. So you will get a pop-up and it will have a picture. And then the message kind of looks like what you see here with that little yellow triangle. That site is not spam. It's actually directing you straight to our survey. We will also add a survey link to the Encore presentation. Just click on the survey picture at the end of the Encore presentation video to take our customer satisfaction survey. Based on your feedback, we've added several enhanced features to improve your educational experience. Our Encore presentation videos now include chapters, making it easier for you to find key information quickly. We've also introduced training indicators during webinar registration to help you identify the intended audience for each session. So whether it's billing, clinical, Part A, Part B, new to Medicare, we do have a bunch of training indicators that can really help you pinpoint which ones are appropriate for your office and for your educational needs. So we do hope these enhancements make your learning experience even more valuable and accessible. And I'm going to just quickly take a look in the chat again, and I do not see any questions. So I'm going to go on to the last slide. So on behalf of myself, Mary Sue, and Provider Outreach and Education, thank you for attending today's webinar on flu vaccination and administration. As a reminder, this presentation will be posted as an Encore presentation on our Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.